Okay, Mr. J, how are you today?
Good, thanks.
Awesome. My name's Tom. I'm going to be your representing physiotherapist today, so if you'd like to grab a seat, we can begin.
Yep.
How was the weekend for you, Mr. J?
Yeah, it's good.
Yeah.
Had a real good time. Just been went to the beach and
Sweet.
hung out with a couple of friends. It's been good.
Yeah, what more could you want?
Yeah.
All right, so Mrs. J, as I mentioned, my name's Tom and I'm a student physiotherapist of Charles Sturt University.
Yeah.
And as a physiotherapist, it's basically my job to listen to your complaints regarding whatever the problem may be and try to, I guess, devise a plan towards helping you overcome that. So look, it's very nice to meet you and have the opportunity to work alongside you today.
Yeah.
Now, what we're going to be taking you through today, Mrs. J, is what is called a subjective assessment. Now, you may or may have heard of what that involves, but pretty much I'll just be asking some questions and the answers to those questions I'll be using to help get a better understanding of what the condition may be so we can work towards making a plan.
Sounds good.
Yeah. So before we begin, have you got any questions about subjective assessment? Anything I've said so
no,
far?
I'm pretty sure you covered it well.
Pretty good?
Yeah.
Awesome. We'll jump into it then. So, Mr. J, what brings you here today? What seems to be the problem?
Well, I seem to be getting pain in the right side of my pelvis.
Yeah.
I noticed it after I was gardening.
Yep.
I had the shovel and I tend to use my right leg to push down on the shovel to do some holes for some of the plants that I was planting, and it just slowly. It didn't happen suddenly. It was more or less
Gradual.
Gradual, because I done it 4 days in a row, and it just
Okay.
started getting a little bit too much for me.
Yeah. If we talk about kind of the pain levels, if 0 was no pain at all, 10's the worst pain you've ever imagined, where does this pain sit for you on a scale of 1 to 10?
Out of 10, it's probably about a 4 out of 10,
Yep.
and also it sometimes goes down the back of my my right thigh.
Yep.
I've had this for about 3 months now. I kind of just tried to just to back off on everything and just kind of chill out a little bit, but it seems to not go away, so that's why I'm seeing you here today.
So it's a persistent thing. It's just kind of
it's not really getting any better.
Yeah. In terms of what kind of pain it is it an ache or is it a shooting pain, a sharp pain?
Well, when it's an ache, it's probably about a 4 out of 10.
Yeah, right.
But every now and then, it tends to be a sharp 8 out of 10, and that's just local to my hip.
So
or to my
quite
pelvis.
painful.
Yeah, very debilitating.
Yep. Okay. In terms of past history of this condition, is it something you've experienced before?
Now, I've had a similar pain because I have been pregnant
Yep.
before with my first child. Now, this was 3 years ago, but it was nowhere near as severe, so I'm not sure if it's somehow linked or...
Oh, okay. And did this kind of go away? Did you get treatment for it?
This actually settled without treatment.
Settled,
so
okay.
I thought this time around I might do the same thing, and I thought it would resolve itself, but it hasn't.
Yep.
So that's that sharp pain in my right pelvis. Yeah.
Okay. In terms of aggravating factors, in terms of what makes it worse, is there any activities that you go about during your day that tends to flare it up?
Well, when I'm in bed, what really seems to aggravate it is lying on my left side.
Sure.
So putting pressure on it, and also I own a 4-wheel drive, so as you can imagine, some of them are quite big, so I have to kind of take a big step to get up into my car.
Absolutely.
And every now and then it seems to get caught and aggravated
Okay.
while I'm jumping in and out of my car. Also, I have stairs in my house, and going up and down stairs.
Yeah.
So pretty much overall, anything that I'm really engaging or using, it tends to aggravate it.
When you put in kind of pressure on the joint, it seems like it's giving you a bit of trouble.
Yeah.
Yeah.
So usually, if it does become aggravated with any of them activities, it tends to take 15 or 20 minutes to settle.
Okay.
Um,
And it settles down on itself without your intervention. It kind of just goes away.
Yeah. Now I have been doing some aqua aerobics to kind of take a bit of tension off.
Yep.
It kind of helps, but it kind of doesn't, if you know what I mean. Like some days it'll feel good, other days it doesn't feel so good. So
it aggravates it?
Yeah, a little bit. I'd say it is starting to aggravate. It's pretty much just I've been doing a lot of trial and error with a lot of different activities.
Yeah. And you haven't yet obviously found something that's helped out?
No, not really.
Okay.
I've just been trying to do other things like, say, lying on the other side.
Yeah.
Like when I'm in bed, lying on my other side to
Yeah,
try
sure.
and ease the pain.
Yep.
And I also tend to find that having a pillow in the side of my on the inside of my legs as well tends to help.
Right. Yep. Absolutely. And what about easing factors? You mentioned that having the pillow there helps. Is there anything else that has been helping it out?
Let me think. Yeah, having a hot pack does tend to
Yep.
relieve a lot of the pain too.
Okay.
And like I said, also being in the pool,
Yep.
in the acro aerobic we do a lot of exercise, and I find that some of the exercises tend to aggravate. But if I'm kind of just gently swimming around, I feel like that tends to ease it a little
Yeah.
bit.
But if it's more vigorous and
yeah,
intense,
more vigorous,
no
it
good.
doesn't like it.
Doesn't like it.
Yeah.
Okay. Absolutely. In terms of the pain over 24 hours, what I mean by that is, I could say across a day, what parts of the day in your bed or whatever tend to flare it up, and what makes it better?
I tend to feel the night.
Night.
At night time, it tends to ache the most, especially when I'm sleeping.
Yep.
Some nights I feel like it's that intense that I just really can't fall asleep. So
Is that right?
yeah, so I
That's
try
not
and
good.
take some anti-inflammatories to ease the stresses of that.
Yep.
And it tends to help a little bit.
Okay.
Yeah, and also, like I said before, lying on my left side, that will tend to wake me up. So even if I start to fall asleep on my right side, and then I wake up and I'm on my left side, that's tend to what's that aggravate it.
Yeah, right. Okay. And what about when you get up in the morning? Is there any soreness immediately after getting up? Or?
There's only sharp pain after certain movements, so
Yep.
it takes usually 20 or 30 minutes to warm up, kind of thing.
Right.
As soon as I get up, it tends to feel very, very stiff. So yeah, as soon as the blood gets going and I start moving around, it tends to ease it a little bit more.
Sure.
And also when I'm sitting in the car as well.
Yeah.
So when I get up into that big four-wheel drive, it still tends to ache while I'm sitting down.
Yeah.
So you can never win.
Yeah, absolutely. Okay, and you've kind of touched on this a bit, but does the pain prevent you from carrying out any daily activities at all? Does it stop you from those kind of daily activities?
No, not so much. I wouldn't say it's to the point where I can't bear the pain.
Yep.
I'm usually fully independent, pain free. Like I said, it's only a couple of movements that really it seems to catch
Sure. Yep.
and hurt. It's more or less just having that pain there. I'm just sick of it, really.
So what you're saying is you can function kind of independently, but it just irritates you being there constantly.
Yeah,
Absolutely. Yeah. Just got some questions regarding, I guess, your social situation.
Yeah.
Do you have anyone at home that supports you at all, or are you living alone?
No, so I've got a partner.
Got a partner, yep.
And I'm also looking after 2.5-year-old daughter, flat above our family business.
Yep.
But apart from that, I don't have any other siblings or anyone that I live with.
Yep. And what about your living situation? Is it a single-story house, or does it have stairs?
It's a double story. So like I said, we're on the top of our business.
Yeah.
So there is a flight of stairs to get up to our apartment.
Yep. And obviously climbing these stairs, does that tend to flare it up at all?
A little bit. Like I said, some days it doesn't, some days it does. It all depends on the day, kind of thing.
In terms of your working situation, are you currently working, or is this preventing you from carrying out that?
Yeah, no, I'm still working.
Still working?
I'm a contractor for the Australian Post, so I do that 3 days a week, using my own vehicle.
Yep.
Now, like I said, sometimes sitting down the 8 does seem to increase. So every now and then I've got to get out between shifts and kind of stretch out a little bit, and then I can just continue about my business.
But apart from that, you don't find you too impeded to carry out your work?
No.
Yep. Awesome. And what about any medication? Are you currently taking any meds or anything?
No, I'm on no medication apart from the anti-inflammatories when it does get aggravated. But apart from that, the doctor hasn't, that I've seen previously, didn't prescribe me with anything.
Okay.
So.
Yep. And just another couple of questions regarding general health. Have you had any rapid weight loss or anything lately at all?
No rapid
No
weight
rapid
loss or anything.
Yeah. No surgery or anything like that?
Now I did have an appendectomy when I was 16 years old, but apart from that, nothing.
Awesome. Okay. And finally, I guess most importantly, what do you want to get out of doing physiotherapy? What are your goals? What are your outcomes?
Pretty much I just want to stop the pain from getting worse. That's
Yep.
that's the biggest thing. Like I said, I can do a lot of my day-to-day activities without experiencing that pain, but it always seems to be there, and it's just enough to notice and to pretty much piss me off kind of thing.
And kind of decrease your quality of life, I guess.
Yeah. And
Absolutely.
also to be able to continue work for another 2 months, and obviously sleep better without getting woken up in the night.
Yeah. So I guess what you're saying is that you're fully functional. You're able to kind of get on with your life, but it's just that kind of niggling pain that's always offsetting that. Okay. Well, thank you very much, Mrs. J, for the information. That's all I needed from you today. Work towards putting you on a plan to getting you back to your best health as soon as possible.
Beautiful. Thank you very much.
So thank you for coming in today. It's been a pleasure working with you.
Thank you.